So hello everyone. Pleased to meet you. I'm Fedor Galkin from Deep Longevity. Really excited to meet all of you. Now, we've had really exciting, thought-provoking presentations on this session. Mine will be from more of a practical side on how to implement our knowledge about human longevity and how to extend human life practice and what can that bring to the humanity. But first, a couple of words about myself. Who am I? I'm Fedor Galkin. I graduated from Moscow State University with a degree in bioengineering and bioinformatics in 2018. Since then, I was working for In Silico Medicine, a company which is now focused really hard on AI-driven drug discovery. And in 2020, a department of In Silico Medicine dedicated to the study of biomarkers of aging split into its own spin-off company called Deep Longevity, which is currently a publicly traded, belongs to a publicly traded Hong Kong company, Endurance RP. And we are part of that investment fund, and we are working on developing aging clocks and developing applications for making this technology publicly available. Currently, I'm residing in Dubai. In Silico Medicine has recently opened the research center in Abu Dhabi, and here I am in a local dry Skandura during the opening ceremony of In Silico Medicine's research facility. The publications, we try to keep a steady pace of publications. Some of them started, some of them appeared while we were still not Deep Longevity, but we're still In Silico Medicine. My personal record is a bit more modest, but we keep publishing and validating our aging clocks, and I will go over some of our publications and studies on the utility of aging clocks today. My personal interests mostly lie in metagenomic aging clocks, how human gut communities contribute to aging, to the aging phenotype, psychology of aging. I believe that Manuel here will also talk extensively about the psychology of aging a bit later today, and clinical biomarkers of aging. How can we assess human aging, the pace of aging in clinical practice? Now, without sounding too much like I'm preaching to the choir, I believe that everybody here realizes the potential and the importance of biogerontology and studying aging. But yeah, just shortly to go over the main principles behind aging clocks, why they matter, and why machine learning or artificial intelligence matters. I just highlighted the key points that, well, aging clocks currently are the only available tool to scientists and anyone else trying to work in biogerontology to assess the pace of aging in a person in a relatively quick fashion without waiting decades. And this wonderful tool can help us develop a number of anti-aging drugs, therapeutics, or on a more personal level, help us understand what makes us younger and how to keep these things in our lives. And conversely, exclude the things that make us older. And why AI models matter. Deep Longevity is in the intersection of the study of aging and AI technologies, because we are trying to use AI engines and AI models to gain useful insights about how to prevent increased pace of aging in humans. But from a more economical viewpoint, AI has a great promise of greatly improving the throughput of healthcare systems and bringing health services to people who are uninsured, underinsured, who do not want to spend too much effort thinking about their personal health, and quickly point them to the optimal direction of self-improvement. But also it enables a number of settings for mass screenings on a national level, on organizational level. If you're, for example, a huge employer and you have thousands of employees and you want to understand what you can do to make sure that your employees stay healthy, productive, and live just generally better lives. And just as a small side note, I'm really impressed by I believe everybody's impressed by the pace of development of AI models, in particular language models. We will be looking into that shortly, and it seems like a lot of jurisdictions around the world are also picking up the pace and are trying to provide the legal structure for the implementation of artificial intelligence in human studies, in human healthcare. And I strongly advise everyone here to look up this document. It's a guideline on policies for European Union on how to treat artificial intelligence in healthcare from a legal viewpoint. Very interesting and thought-provoking reading, just to understand what we are all going to be facing in the future. If you are working with AI or biogerontology, this is a document a must read, in my opinion. And what's important, it also highlights some common perceived public worries about the applications of AI intelligence. Unfortunately, this document was published, I believe, early summer last year, way before ChatGPT and other models, AI models, gained traction and became the topic of the talks at every cooler. So I wonder how the public perception of AI models in healthcare has shifted since then. Well, hopefully an updated version of this document or something similar will be published sometime this year, so we can see whether the development sessions ChatGPT have improved our public worries about biases, information protection, and information security, and ease of applicability of such models in practice. Yep. So here I tried to outline all the various industries that can benefit from AI and aging. Let's just talk about aging clocks in general, whether they're AI, machine learning, or something else. We can talk about insurance. People who are underinsured or uninsured, they can use these models as a cheap, affordable way to assess the necessity of investing in an insurance policy. For example, if you cannot afford a really good policy, at least you will be able to understand whether you need it. And if an AI model tells you that, well, you might have some hidden or sleeping conditions in your body, latent conditions in your body that might manifest in the next couple of years, well, it's a good idea to actually get a policy, and this might help a person finally make the right decision. Diagnostic centers, right? So there is a large number of models which analyze MRI scans and all sorts of clinically available information to improve diagnostics. And in some cases, such models perform better than trained professionals, although such models will not be the topic of this presentation. And another of other industries, such as pharma, who can use aging clocks to as a target to be improved during drug development process, or as an endpoint during a clinical trial, can use that. And all the other industries can also benefit in some way from aging clocks. Here's an arsenal of our aging clocks. We have like a treasure chest of different types of biodata that Deep Longevity can analyze. And let me try and move this. How do I move this tab out of the way so that we can see the subtitles? Yeah, so some of these aging clocks are patented and are currently being implemented on our Sciinov Clock platform, which is, can I go further? Yeah, which is a B2B platform of an online access point for aging clocks for whatever business or industry you represent. Currently, we only have blood age or an aging clock for clinical blood tests there. We have mind age, an aging clock that assesses some psychological trends that appear with aging and help you build a better lifestyle there. But by the end of the year, we will definitely add deep age and aging clock based on epigenetic information from Illumina Infinium arrays. And currently, we are actively working on adding a microbiome aging clock that we have finished the research phase for and currently in the product development stage for. As I said, many of these technologies are patented and have been validated in a number of studies, some of which I will go over right now. So our probably first publication with an extensive validation of the blood age model, that is a model that uses clinical blood test, much similar like our Chinese colleagues presented earlier today, to provide a person with a measure of their pace of aging. That is how far away they are from some ideal golden standard of human progression from birth to elderly age and eventually death. If a person's predicted biological age is way higher than their chronological age, we consider them a fast ager. And this fast aging status is associated with a number of health conditions and increased mortality rate. We used data from several populations in this exact publication to come up with this kind of main message that being in a fast aging group, as identified by an aging clock, is associated with a significantly higher mortality rate in the next 5 years. Our other findings in this field relate to the effect of smoking on your pace of aging. In this case, smoking is detected as a condition that increases your pace of aging. So this study served as a major point of validation for proving the biorelevance of our blood aging clock. But if you look closer, there is quite a curious tendency among the oldest old smokers who actually are a bit younger than their non-smoking counterparts. Well, this is quite a bit of an embarrassing, a bit of an interesting point on how to treat the insights gained from aging clocks. Well, you might have guessed it, but this is like a typical example of survival bias. That if a person can afford to be actively smoking in their 80s, well, they have won the genetic lottery. All other smokers who haven't won that lottery have already died by the age of 80. We also applied the same technology to assess the impact of COVID on your pace of aging. Apparently, suffering from COVID significantly increases your pace of aging, and people also who have high pace of aging during admission, they have a much higher likelihood of suffering a lethal outcome. And this is the most recent publication we did with a blood age similar setting. That was a study completed with data obtained from Charles. And we developed a similar aging clock with featuring 16 parameters of biometric measures, and out of those 16 parameters, 12 were blood biomarkers. And after completing this aging clock, we tested what other contributors that are available in the data, in the metadata for these samples, increase or decrease while space of aging. And apparently, poor psychological state, which can be described as a person who rarely feels hopeful, person who has trouble sleeping, person who often feels lonely, such people, they suffer from a significantly increased pace of aging. In fact, their pace of aging is increased by their poor psychological state. I wouldn't say way more, but slightly more than by being a smoker. Some other interesting insights include that, well, the rural population in China ages slightly faster than the urban counterparts, and this is also a fact described in some other papers about the Chinese population and Chinese elderly, that the accessibility of healthcare services is not as good in rural areas, as well as the hard physical labor that people do in rural areas also contributes to their increased pace of aging. But to sum it up, this technology allows us to assess which societal factors, economical factors, and which psychological factors can contribute to your pace of aging. And one of our goals as of an organization is to help people affect, or at least find the points that they need to interact with to decrease their pace of aging, so that their mortality rate goes down, so that their risk of developing an aging-related disease in the future goes down. And apparently, looking at this pace of aging situation from the viewpoint of psychology is a viable strategy. And now closer about what actually blood age is. We have a number of models which qualify as a model that can interpret clinical blood profiles in terms of aging. The most popular one by far is the so-called vanilla blood age, which features a total of 45 biomarkers, including your biological sex, to return a highly reliable measure of your pace of aging. All the biomarkers here can be grouped as part of either of the two commonly used clinical blood panels. It is either the complete blood count panel, which describes all the cellular elements in your blood, such as erythrocytes, white blood cells, etc., or a comprehensive metabolic panel, which stands for your minerals, lipids, and liver profile as well. So only the very basic stuff that you get measured anytime you have a checkup in your clinic. The advantages of this technology compared to some other aging clocks, such as epigenetics, or, well, some other that we are currently working on, such as metagenomic aging clock, is low cost, very affordable, because all you need is basically 2 blood panels, which can be delivered to you within days, while in some omics-based clocks, getting the information can take weeks, maybe months, depending on the turnaround time at the lab service facility that you have contracted. Labs are widely available, and the clinics already they either run their own labs for these type of tests, or they have already figured out all the logistics. So this is one of these AI technologies that is ready to be implemented in real life healthcare practice. Unlike some other aging clocks for which you need to spend extra time and effort to make sure that the doctors, they understand what epigenetics is and how to use this information in practice. Not all aging biomarkers are equal in this model, and some are way more important for the blood prediction, but still, even if a person, even if a doctor tells that we can only do finger prick tests, we actually experimented with this type of setting by trying to reduce the number of biomarkers and retraining the aging clocks using a reduced number of biomarkers. So apparently, as long as you are able to present at least 30 biomarkers from this list, 30 top biomarkers, you should be fine. The improvement in accuracy from that point onward is not that significant. So if you have a client that, well, are cost conscious, I believe is a word, you can safely pick and choose 30 biomarkers that they are ready to pay for, and you will not see a significant decrease in the quality of reports provided to this user. And yeah, as I said, that everything before was talked about the vanilla blood age model. We also experimented with a finger prick blood age model, which means that in finger prick tests or tri-spot tests that are sometimes collected as parts of home kits, you do not have the opportunity to measure cellular profiles. You will lose information about the composition of white blood cells, red blood cells, platelets. It'll be only to measure those parameters that are represented by, well, a chemical or a protein. But even then, even in such settings, we are ready to provide models that have good accuracy and still can provide useful insights to a person who aims to build a longevity-focused lifestyle. So now on to Sciinov, the B2B platform for aging clocks or an access point for aging clocks and people who want to work in biogerontology from any industry. We launched this platform last November and are constantly updating it. We have been going for primitivistic user interface so that you are not overloaded with all the various dials and settings. All you need to do is to, well, first contact us to help set you up with an account. And after that, the interface should be pretty intuitive because it's just drag and drop box. And you press the magical button, which returns you in a matter of seconds a PDF report that you can show to your user or client or colleague. We also offer access to our aging clocks over API, so you can, so if you have your own health platform or you want to process large batch uploads as a scientist or a researcher, you can do that programmatically. You do not need to drag and drop items into a box and download and then eventually parse PDF reports. You can interact with just JSON objects easily if you wish so. So yeah, as I said, we have two types of reports available on Sciinov. One of them is blood age. That one is mind age report. And I believe this is the end of this presentation. So I will just showcase you, it's not yet. I will showcase you a bit later the kind of demo units of what these reports look in real life. But for mind age and eventually we hope to extend this feature to other aging clocks. The key feature is that you can send a person, imagine you're a psychologist and you want to run around initial assessments if you're working in group therapy. So you enlist your group, you send all of them a link to personal reports, and your clients do not need to register on a service. They just go to a web page. They from desktop, from mobile phones, whatever they prefer. They fill in a survey, and this survey appears in your account as instead of a medical practitioner. And eventually, this functionality will be extended to other types of aging clocks, so that the end user does not need to spend too much effort to get these insights from our platform. And this is just before we proceed to mind age and blood age reports, I wanted to just highlight some of the key concepts that we use in this study of psychological aging. And also, if you're wishing to do something on your laptop, you can go straight to this website, because this website features a publicly available free, no strings attached version of our mind age aging clock, which is based on taking a large data set of people and trying to place them on a self-organizing map, and which is a method of unsupervised learning. But shortly, self-organizing map is just convenient visualization of complex multidimensional data on a 2D plane. And the good thing about this type of visualization is that when you put thousands and thousands of people on this self-organizing map, eventually you end up with a heat map, because some of these regions, they attract more people than other regions. And the type of people that gravitate toward particular regions can tell you a lot about who you are, about your own psychological profile, if you end up in one of these hotspots. In the accompanying article, we, I believe, used the probability to develop depression as the kind of guideline to highlight the regions that are associated with, well, poor psychological state or good psychological state. And the core concept behind Future Self and the Mind Age report is that if you end up in one of those red zones, that is not really good. You have just ended up in a region with people who are generally miserable and who like 3 times as likely to develop depression as somebody in one of the green zones. So, but thankfully, the self-organizing map is quite granular. So by introducing positive yet simple to implement changes in your life, you can step by step move along a pathway of least resistance from where you currently are and miserable to where you should be worried. And yeah, in Future Self, we tried to implement a recommendation engine, which is still a work in progress. And eventually, we believe that this technology will be highly valued by, as I said, for example, employers who are eager to improve the productivity of their workforce, but not necessarily only them. I have no idea. Are they trying to tell me something? Can I mute anyone? More. Okay. Disable. Leave. All right. Yeah, seems that way. Okay, yeah, so if you're interested in learning more or interested in an academic collaboration, we're open to that project, to that type of collaboration. You can just send an email here, or you can use my email, just fedor@deeplongevity.com. You contact me and propose an academic collaboration or a commercial collaboration if you're interested in such thing. Now, let's give you a look at what blood is like. Okay, so currently this is what person will get after completing their blood age. The design is highly customizable. If you wish to make it more fancy or choose different colors for the visualizations, this is up to you. But here I uploaded my full PDF test into the platform and received first the information that I'm slightly below, but still around my real chronological age, at least was this January. But there is still room for improvement. I can shave off extra 3 years of biological age if I follow the recommendations provided at the end of this report. Okay. And here are some highlights that tell me about, well, what is actually wrong with my blood profiles. So the red lines instantly draw users' attention. And yeah, my lipid profile is now good. And I can also see whether it is really bad or not that bad. Well, very poor. I should definitely try to decrease my intake of foods that promote high cholesterol. We also offer the interpretation of all features as viewed by our AI aging clock. I was 27 at the date of this analysis, and quite a few of my biomarkers were more representative of a person who is, well, 28 years old. And these should be the primary target for my self-improvement journey: diet, exercise regimen, supplement regimen. This is basically a reinforcement learning algorithm that not yet. These are SHAP-based values. This is where we use reinforcement learning to also highlight which combination of 3 biomarkers will improve your pace of aging with the least amount of effort. A bit more on how exactly we calculate your pace of aging. This is more of a technical page just to let people see what are other contributors to their pace of aging and just to make sure that all the numbers add up. More technical page just to make sure that all biomarkers have been recognized correctly, because some people upload PDF texts, and in this case, we need to make sure that text recognition has worked properly, and all the units were recognized the right way. In which case, a person, a physician, or an end user themselves can just take the printout of their blood panel, take this printout, and compare that the numbers match. If they don't, well, we need to work on our parser. Yes, and some recommendations we provide to tell people how to improve their blood biomarkers, such as, I don't know, ways to reduce, improve chloride concentrations, potassium, what type of supplementations they need to take. And these base of recommendations is constantly growing, and we usually modify it on a client-to-client basis, since some clients are interested in providing a particular type of recommendations. or, for example, are interested in removing a particular type of recommendations. For example, if you are not a medical organization and you are not authorized to tell people that, well, you might have a particular disease based on your blood profile. In this case, we turn off a number of recommendations and they will never be displayed to your end users. Although in clinics, yeah, we can offer people more medically relevant information about their pace of aging. And now, where was that? So for the MindAge report, you can either go to futureself.ai and take a quick, I believe it takes under 5-7 minutes, psychological questionnaire to get your own version of MindAge, which you can view in browser. But the concept is generally the same. That first of all, what's your psychological age? How many people in your age group are older than you? How many of them are younger than you? We also employ a Reef scale of psychological well-being. This is a scale which breaks down your personality into 6 parts. Well, not really personality, but at least your properties to effectively interact with the surrounding world and your priorities. Going back to the publication we did on self-organizing maps and the likelihood of someone developing a depression, well, the 3 zones, displayed here as distress, improve, and comfort, they represent the typical levels of psychological well-being scores in the different sections of the self-organizing map. So people who are most likely to develop depression, they gravitate towards a cluster of cells on the self-organizing map in which their well-being parameters will typically be somewhere in the distress zone. Improve zone is like a medium ground, and comfort zone. If you have several biomarkers in that zone, that means that you're pretty well protected from depression. Although we do not say depression anywhere in the text of this report, since depression is a clinical diagnosis, and we are not authorized to do that on our own, only if medical professionals are involved. So this is kind of the point that you always need a human professional to follow an end user or a client to make sure that they do not interpret this colorful graphic the wrong way. Yeah, so the 6 parameters, these motivations evolve with life, and shortly about some of them are self-explanatory, like positive relationship with others, how well you can communicate with others, how well you maintain those relationships, self-acceptance, the ability to review your personal experiences and present them in your own narrative as a positive learning experience. And even that means that even some mistakes, that you understand that those mistakes were necessary for you to learn some life lessons, as opposed to somebody who has low self-acceptance. That would be somebody who, well, feels miserable about their life choices and feels like a failure because, well, 10 years ago they did not, I don't know, graduate from a college and decided to take up welding classes, or stay on their own career path, or anything else. So they do not see their life as a process of an evolution from worst to best. Yeah, autonomy is the ability to protect your own opinion, even in the face of authority. Personal growth, self-explanatory. Environmental mastery is your ability to face everyday life challenges efficiently, and purpose in life, also self-explanatory. And yeah, we also present a personal breakdown of what high and low scores mean for each person, and just short proposed interactions between a person and their therapist, or some tasks that they can carry out on their own, like journaling and some mental exercises that can help them improve their well-being and eventually move from that red zone on the self-organized map to the green zone. Okay, so I guess that concludes my presentation. Hopefully I have managed to put it into 30 minutes or under. Any questions?